Chapter 1. Understanding Trauma. From PTSD to Generational Healing. Introduction. What is trauma? Trauma is often seen as a profoundly personal experience, yet its impact extends far beyond the individual, rippling through families, communities, and even across generations. While post-traumatic stress disorder, PTSD, is the most well-known trauma condition, trauma manifests in many different forms, each with unique effects on the body, brain, and emotions. Whether from a single life-threatening event or from prolonged exposure to adversity, trauma fundamentally changes how the body functions, leaving long-lasting scars. In this chapter, we explore the various types of trauma, from PTSD and complex PTSD, CPTSD, to post-traumatic stress injury, PTSI, as well as the more nuanced traumas such as adverse childhood experiences, ACEs, intergenerational trauma, and gestational trauma. We also dive deeper into types of trauma less commonly discussed, but equally impactful. Adoption trauma, medical trauma, relational trauma, and betrayal trauma, among others. By understanding this spectrum of trauma and its widespread impact, we can better appreciate the journey toward healing. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, PTSD, is a condition that develops after an individual experiences or witnesses a life-threatening event. Whether from combat, domestic abuse, a natural disaster, or another source of intense fear, PTSD alters both the brain and body. Flashbacks, nightmares, anxiety, and hypervigilance are common symptoms that keep individuals reliving their trauma long after the event has passed. The nervous system remains in a constant state of fight or flight, leading to chronic stress and physical symptoms like headaches, muscle tension, and digestive issues. PTSD is not just a mental health disorder. It is a full-body experience that impacts how the body responds to future stress. Complex post-traumatic stress disorder, CPTSD. Complex post-traumatic stress disorder, CPTSD, develops from prolonged exposure to trauma, especially in situations where the individual feels trapped or powerless. Unlike PTSD, which is often linked to a single traumatic event, CPTSD stems from ongoing trauma, such as childhood abuse, neglect, domestic violence, or long-term captivity. CPTSD is characterized by emotional dysregulation, negative self-image, and difficulty forming healthy relationships. Survivors often struggle with feelings of worthlessness and chronic fear, unable to move beyond the constant state of threat they have lived in for so long. CPTSD frequently leads to more complex psychological wounds than PTSD, affecting the individual's mental health and their ability to navigate the world around them. Post-traumatic stress injury, PTSI. Post-traumatic stress injury, PTSI, is a newer term that reframes trauma as an injury rather than a disorder. This term is particularly relevant in military and first responder communities, where trauma is often seen as a result of the demanding and dangerous nature of their work. By viewing trauma as an injury rather than a disorder, PTSI helps reduce stigma and emphasizes that trauma can be healed, just like any other physical wound. PTSI recognizes that trauma leaves both psychological and physiological imprints on the brain and body, but it also emphasizes that recovery is possible with appropriate care. This redefinition is an important shift for those who have felt burdened by the disorder label, promoting hope and healing. Adverse childhood experiences, ACEs. Adverse childhood experiences, ACEs, refer to traumatic events that occurred during childhood, such as physical or emotional abuse, neglect, or household dysfunction like substance abuse or mental illness. These early life traumas significantly shape a child's development and are strongly associated with long-term psychological and physical health challenges. High ACE scores are linked to increased risks of mental health disorders, chronic illnesses, addiction, and difficulty forming healthy relationships later in life. ACEs also illustrate how trauma during critical developmental periods can have a profound, lasting effect on both brain and body development, leading to patterns of hypervigilance, emotional dysregulation, and even chronic illness. Intergenerational trauma. Intergenerational trauma, also known as transgenerational trauma, refers to trauma that is passed down from one generation to the next. Trauma caused by historical events, such as slavery, genocide, or war, leaves scars not only on the direct survivors, but also on their descendants. This trauma is carried through family systems, manifesting as anxiety, depression, or even physical symptoms in those who may have never directly experienced the original trauma. Research has shown that trauma can alter the genetic expression of descendants, changing how stress is managed at a biological level. Intergenerational trauma highlights the importance of healing not only for the individual, but for the generations that follow, breaking the cycle of trauma transmission. Gestational trauma. Gestational trauma occurs when a mother experiences trauma during pregnancy, which can have direct effects on the developing fetus. The heightened stress and cortisol levels of the mother during pregnancy can alter fetal brain development, leading to increased susceptibility to mental health disorders, emotional regulation issues, and developmental delays in the child. These effects can last long into adulthood, showing that the prenatal environment plays a crucial role in shaping future mental and physical health. Gestational trauma indicates the process of trauma can begin even before birth, influencing the health and well-being of the child from their earliest stages of development. Expanding the definition of trauma. Trauma can arise from many sources, not limited to the well-known categories of PTSD or CPTSD. Adoption trauma, for example, can leave deep emotional scars tied to identity and attachment. Medical trauma refers to the psychological effects of invasive procedures or medical interventions, while relational trauma stems from the rupture of significant relationships, whether through betrayal, emotional neglect, or abandonment. Betrayal trauma occurs when a person, often someone in a position of trust, violates that trust, which can be devastating. Death trauma and traumatic grief occur when individuals are confronted with the sudden or violent death of a loved one, leaving them to deal with both the immediate shock and the long-term emotional fallout. In addition to these, natural disaster trauma and refugee trauma highlight the devastation caused by displacement, war, or climate-induced crises. With the increasing frequency of climate change-related events, climate-induced existential traumas have emerged as people face the anxiety and uncertainty of an unstable physical environment. Trauma can also result from religious or spiritual experiences. Religious and cult trauma affects individuals who have been manipulated or harmed within these contexts, while spiritual trauma can develop when one's core beliefs are violated or shattered. Furthermore, pre- and perinatal traumas involve experiences during pregnancy or childbirth, which can have lasting impacts on the woman's development. Cultural trauma refers to the collective trauma that can affect entire communities, often rooted in historical oppression, colonialism, or systemic discrimination. This type of trauma is not just personal, but part of a people's collective identity, as seen in many indigenous communities or groups affected by historical atrocities. Expanding the understanding of trauma. As you can see, the concept of trauma has expanded beyond PTSD to include a wide range of experiences and conditions. Understanding trauma in its various forms, whether it's CPTSD, PTSI, ACEs, intergenerational trauma, or adoption trauma, allows for a more nuanced and comprehensive approach to treatment. Each type of trauma has its own effects on the mind and body, but all forms of trauma affect the nervous system, leading to prolonged states of stress and survival that hinder recovery. By recognizing the diverse ways trauma manifests, we can create more individualized and effective healing approaches that address not just the mind, but the body and even the family system. Key takeaways. Trauma is a complex condition that affects both the mind and body, manifesting in different forms. PTSD is just one type of trauma. Prolonged trauma can result in CPTSD, while PTSI reframes trauma as an injury rather than a disorder. ACEs, intergenerational trauma, and gestational trauma illustrate how trauma affects families and generations and can even begin before birth. Medical trauma, adoption trauma, relational trauma, and cultural trauma are important categories that reveal trauma's breadth. Understanding the full spectrum of trauma allows for better treatment approaches that address both emotional and physical healing. Next steps. In the following chapters, we'll dive deeper into how trauma affects the body at the cellular level and explore the various treatment options available to help break the cycle of trauma. From cutting-edge therapies to holistic healing practices, here you'll learn about the most effective ways to recover from trauma and reclaim your life. References: Anda, R.F., Felitti, V.J., Bremner, J.D., Walker, J.D., Whitfield, C., Perry, B.D., Dubé, S.R., and Giles, W.H., 2006. The Enduring Effects of Abuse and Related Adverse Experiences in Childhood. A Convergence of Evidence from Neurobiology and Epidemiology. European Archives of Psychiatry and Clinical Neuroscience, 256, 3, 174-186. https://doi.org 10.1007 0406 05 06244. Bremner, J.D., 2006. Traumatic Stress, Effects on the Brain. Dialogues in Clinical Neuroscience, 84-445-461. https://doi.org 10.3187/dcns.2 006.8.4/jbremner. Navio, R.K., 2014. Metabolic Features of the Cell Danger Response. Mitochondrion 16-7-17. https://doi.org 10.1016/jmito.2013.08.006. Porges, S.W., 2011. The Polyvagal Theory. Neurophysiological Foundations of Emotions, Attachment, Communication, and Self-Regulation. W. W. Norton and Company.